What is rabies? Rabies is a virus that spreads through direct contact with the saliva or brain nervous system, tissue of an infected animal. It's deadly but can be stopped. If a rabid animal bites or scratches you or your pet, you can get rabies too. Rabies is a serious illness caused by a virus that affects the brain and nervous system. It can spread through direct contact with the saliva or nervous system tissue of an infected animal, typically through bites or scratches. While rabies is deadly if not treated, it can be prevented through vaccination and prompt medical care after exposure. If you or your pet are bitten or scratched by an animal suspected of having rabies, it's important to seek medical attention immediately to prevent the virus from spreading. What happens when you get rabies? When an infected animal bites you, the rabies virus enters your body through the wound, usually slowly traveling along nerves to reach your brain and spinal cord, which make up your central nervous system. Once the virus reaches your brain, it causes damage that leads to neurological symptoms. Eventually, rabies can result in coma and death. How common is rabies? Around the world, approximately 59,000 people die from rabies each year. However, in the United States, human cases of rabies are rare, with fewer than 3 people getting infected annually. This low number is due to many individuals receiving vaccination shortly after being exposed to the virus. Who does rabies affect? Rabies is mostly found in rural areas of Asia and Africa, but it can be found everywhere except Antarctica. In the United States, wild animals are commonly affected by rabies. However, in many other countries, rabies can be carried by dogs. Children are more at risk of getting rabies compared to adults. How does rabies affect your body? After entering your body through a wound, rabies gradually makes its way to your brain, and most people go through several phases. First is the incubation phase, where the virus is present in your body, but you don't feel sick yet. Following this is the prodromal phase, characterized by symptoms such as fever, headache, and fatigue, indicating that the virus is starting to affect you. Then comes the acute neurologic phase, during which the virus attacks your nervous system, leading to confusion, agitation, and difficulty moving. In severe cases, rabies can progress to a coma, where you become unconscious and unresponsive. What are the symptoms of rabies in humans? When you first get rabies, you might not have any symptoms for a few weeks. As the virus reaches your central nervous system, you start to feel like you have the flu, with symptoms such as fever, tiredness, and muscle pain. Later on, you experience neurological symptoms. During the prodromal phase of rabies, you may experience symptoms such as fever, tiredness, and burning, itching, or pain at the site of the bite wound. Other symptoms can include cough, sore throat, muscle pain, and nausea, vomiting, or diarrhea. In the acute neurologic phase, rabies symptoms can manifest as either furious or paralytic. Furious rabies symptoms may include agitation and aggression, restlessness, seizures, hallucinations, muscle twitching, fast heart rate and breathing, excessive salivation, different sized pupils, facial paralysis, fear of water or drafts, and delirium. On the other hand, paralytic rabies symptoms can include fever, headache, neck stiffness, weakness starting from the bitten area and spreading, tingling or strange sensations, paralysis, and ultimately coma. What causes rabies in humans? Rabies in humans is caused by a virus called Rabies, which also affects animals. This virus travels through your body using your nerves, where it causes damage. It stays hidden from your immune system until it reaches your brain, causing brain damage that can lead to death. How do you get rabies? Rabies is carried by warm-blooded animals, like mammals, and can be found in their saliva. The most common way to get rabies is through the bite of an infected animal. Animals like bats, skunks, raccoons, and foxes are commonly infected with rabies, but even your pet dog or cat could have it. If the saliva of an infected animal comes into contact with a break in your skin, you could get rabies. In rare cases, people have gotten rabies from receiving donated organs. How is rabies diagnosed? Unlike many illnesses, it's important not to wait for symptoms to diagnose rabies. If you've been bitten or scratched by a wild animal or a pet that might have rabies, it's crucial to talk to your healthcare provider immediately. They will examine your wound and ask questions to determine if you need treatment for rabies. You may also undergo testing for signs of rabies. When you visit your healthcare provider, they may ask you several questions to help diagnose rabies. They'll inquire about how you were injured and the type of animal that scratched or bit you. Additionally, they'll assess if they can test or observe the animal involved in the incident. If there's a chance that the animal might have rabies, it will be closely monitored for any signs of the disease or subjected to testing if possible. Unfortunately, testing for rabies in animals typically involves euthanizing them in a humane manner. How is rabies treated? Once symptoms of rabies appear, there's no specific treatment available. However, if you've been exposed to rabies, such as through a bite or contact with an infected animal, it's crucial to seek medical help promptly. First, clean the wound gently and thoroughly with soap and water. Then, contact a healthcare provider for further instructions on wound care. Your healthcare provider will administer a series of shots, known as vaccinations, to prevent the rabies virus from causing the disease. Additionally, if you've never been vaccinated against rabies before, they may provide you with an antibody treatment directly at the wound site